afternoon, and I'm Dr. Rwituja Thomas Grover, a consultant orbit and oculoplastic surgeon at Vision Eye Centers in New Delhi. And pertaining to the topic of today, that is tearing disorders and their management, I'm also a lacrimal surgeon. So that is related to the watery eyes and associated conditions. So, when can you get a watery eye really? So, it can happen in a variety of conditions with respect to the most basic and minor things, such as allergic eye disease or allergic conjunctivitis, wherein you have a watery eye, but along with that, you do have some amount of itching as well. So, that is one type of watery eye. You can also have it in other associated allergic conditions such as sinusitis or allergic rhinitis. That is, you may have a runny nose along with a watery eye. So that is one minor cause of watery eye. Now, certain other diseases can also cause watery eyes, that is dry eyes. Now, you may ask how you can have a watery eye when you have dry eyes. So, usually what happens is that when you have dry eyes, your lacrimal glands, that is the glands which secrete tears, they tend to reflexly water more. So you have water overflowing from your eye because your eye is trying to sort of compensate for that dryness. So people who have dry eye and associated issues like meibomian gland dysfunction, wherein the oil glands in the eyelid aren't functioning well, causing evaporation of the tears earlier, even they can have a watery eye. So that will be associated with some amount of burning and irritation of the eyes. Now, other than this, even chronic use of contact lens can also cause certain allergies in the eye, which can also lead to dry and watery eyes. And there are several other conditions which are more severe, serious, and painful conditions which cause dry eye. That is corneal ulcer. So the central black part of the eye, the surface of that, if you have any infection of that, which we call as keratitis, or a corneal ulcer, that can also cause watering. Along with that, there will be a lot of pain, redness, and the watering will be sort of very severe and not something that is bearable. So that would require you to be seen by an ophthalmologist or a cornea specialist and get treated for that, which would sort of resolve everything, one after the other. Now, even having glaucoma or an attack of angle closure glaucoma, as we call it, that can also cause watering, redness. Along with that, you can have some amount of photophobia, that is, inability to tolerate light. So that is another cause of watering. And another cause, a disease in the eye, which can lead to watering, is what we call uveitis, or that is inflammation of the uh, ocular coats. So, and the inside of the eye as well. So, scleritis, uveitis, these are also causes of watery eye. However, these are all associated with severe pain and photophobia, again, with a lot of redness. And this is also these are some of the serious conditions which can cause dry eye. Now, with respect to coming to the lacrimal subspecialty, you can have a watery eye if the part from the eyes where the water leads towards, there's a sac here near the bone, and towards the nose there is a pathway which forms. So from the eyelids, the water which collects in the eye, that sort of gets drained to an area which goes to a sac which is near this bone, and then towards the nose and the throat. Now, anywhere in that nasolacrimal duct pathway, as we call it, or the lacrimal pathway, anything which blocks that can also cause watering. So what essentially happens is the outflow pathway to the tears is blocked. So there's no excessive production of tears, but there is an outflow pathway obstruction, which causes the eye to water. Now, along with this, there may be some amount of discharge as well. So if there is some amount of discharge, that is in this area where the tears are held, there is a collection of pus or mucus material. So when that gets collected, that can cause sort of regurgitate back into the eye and cause that discharge and stickiness and mucus appearance. So this can develop gradually in adults. It can be present, within 1 or 2 months of age in children as well. So you can have the congenital or the adult or the later on acquired forms of nasolacrimal duct obstruction. Now, it's important to understand that there are different types of obstruction. So one that I mentioned is the one which is associated with discharge. Now, that can be treated with a surgery, which sort of restores the pathway of the tears from the eyelids to the nose. It requires some amount of remodeling of that bone by the surgeon, the oculoplastic surgeon, who will restore the pathway of tears towards the nose and the throat. So this is done by this surgery. In case this surgery is too delayed, some people may develop certain swellings in this area, red inflamed swellings, which can be caused because of this pus collecting. So if we leave it for a long time, that pus which collects tends to get infected and sort of stuck in that area, and that can cause a lot of pain, and again watering of course would continue. So that would be we would require to drain the pus and do a more definitive surgery much later. Now, if there is no discharge, what happens is that particular area has to be assessed. So what we usually do is in the clinic, when you first come we assess why you have watering. We'll take your history. We'll ask you what all associated issues you have. And then we do a test called syringing. So that syringing is basically in the eyelid, the hole which takes your tears towards that sac which I mentioned. That area has to be syringed. So there is a small tube which is placed there, and water is flushed through that. Now, if that water directly enters your throat, then you know that that passage is open. So you don't require any sort of surgery for that. But if the water doesn't go into your throat, that means it is coming back into your eye because of blockage at some level. In that case, we know that you need some kind of intervention. Now, if there is discharge, we do advise a certain type of surgery. But if the blockage is much closer to the eyelids, then we have to decide that what we need to do. So there is an other type of procedure which also restores the pathway, or we may opt for a less invasive option. That is by putting botulinum toxin, more popularly known as Botox. That injection would be put into the lacrimal gland. This is the area where the lacrimal gland sits, and it is the place from which the tears are produced. So if we put injection into that lacrimal gland, then that injection sort of helps make sure that at least for the next 5 to 6 months, the tear production is reduced. So this is one way of dealing with it. Now, the other thing is many people sort of try to, press this sac area whenever it gets filled and flush out the mucus. So to an extent, this does delay any infection and surgery. But if that mucus keeps entering your eye can also develop bacterial infections. So it is important that, this condition, if you have it, it needs to be addressed. And that if a surgery is required, it's better to go ahead with it. Now, you may ask, okay, I'm not developing any infection. I'm just having the watering. I'm okay with it. Some people are not okay with it. They have this watering continuously, and that becomes some sort of social embarrassment. So they want to get rid of that, so they get operated. But if they're not concerned with that and they're always okay with dabbing it, certain issues may develop. One is if this area constantly has those tears accumulating, it can cause a skin excoriation. That is, the skin becomes red and inflamed and flaky and dry. So this area can sort of suffer, the skin in that area, and it's very delicate skin, so that can also suffer in that situation. The other thing is that if you have this condition, especially in older individuals, and you have a cataract and you want to get your cataract operated, now it's not possible to undergo your cataract surgery while this area is undergoing a blockage. That is, while the water is not circulating well. Why? Because this pus, if it enters the eye after cataract surgery, the areas from which the cuts are made in the eye to perform the surgery and put the lens, etc., if any bacteria enters through that part of the eye, it can cause a very severe eye infection, which is why we check for this before any cataract surgery also, that there is no blockage in that area. So this is another reason why you might need to undergo the surgery. Now, with respect to children, of course, there is another way to evaluate children who have, watery eyes. So we again look for the allergy and all of that. And we may put a certain dye in the eye of the child as the child is playing in the clinic itself, and then observe to see if that dye is draining out or not. That's another way of getting to know. In children, of course, there are certain other procedures which we've discussed earlier in our Facebook sessions. That is undergoing probing and syringing, or of course DCR after the age of 4 years. Now, suppose you've already undergone a DCR and you're still having watering developing later on, then it's important that we do two things. One is we get the our ENT colleagues, that is the ear, nose, and throat colleagues, to have a look at your nose once to make sure that there's no blockage in your nose which could be causing this, or any deviation. So they tend to take care of that. It's better if we get an opinion from them prior to surgery itself, to make sure that there is no issue which can sort of mess with our surgery. The other thing is that if you undergo DCR for the second time, we'll probably put in a tube. So the tube is basically there to keep that area open, because the second time there is a slight higher chance of failure of the surgery. So the tube is usually removed within 6 weeks or so. So this is about watery eye, its causes, most common to least common causes, and of course we as lacrimal surgeons, what we can do for your dry eye, watery eye, that is. So any questions or queries that you have, we can sort of go ahead and address them. Okay. So we have one question, that is, how can I tell if my tearing disorder is a temporary issue or not? Okay. So it's difficult to say on your own, but if you suddenly develop a watery eye, and if you have certain other associated symptoms, that is a lot of redness or the photophobia, as I mentioned, it's usually going to be a temporary issue. That is something that can be treated by the ophthalmologist with eye drops and so on. But if it is something which is there for a long time, that is more than a year, and you don't have any other associated symptoms other than, let's say, discharge, then it's unlikely that it's going to go away with medicine. So you probably will require a surgery at that point. Okay. Are tearing disorders more common in certain age groups? Uh, it's not restricted to any age group as such. Of course, the congenital nasolacrimal duct obstruction happens only in children, because it's a structural thing, and it presents just after a few weeks after birth. But any individual who has this obstruction can develop. It's, of course, a little more commonly that we see in older adults, that is 50s onwards, but it can be there even in third, fourth, fifth decade as well. So it can happen in any age group. It's not restricted by age. Um, Another question is, what role do tears play in maintaining eye health, and what happens when there is an imbalance in tear production or drainage? So, as I was explaining, that if the tear production is excessive, then you get the watering. Now, if the tear production is less, that is the opposite of the watering, then you can have dry eye. And dry eye can cause a lot of ocular surface disturbance. That is, you can have a lot of irritation. You can have reflex watering after that. Um, and this can damage the eye if not investigated and taken care of. So certain autoimmune conditions can also cause this sort of imbalanced tear production. So that is one of the ways. For excessive watering and for block drainage, we've already discussed. Can tearing disorders be a sign of an underlying mental medical condition? So usually tearing is not really related to anything else in the body, other than, of course, as I mentioned, the allergic tendency that you might have, that is the allergic rhinitis and things like that, which may be associated with it. But tearing disorders not really associated with any other medical condition. Uh, when is surgical intervention necessary, and what are the common surgical procedures? So, surgical intervention, like I mentioned, is necessary when it is sort of not going on its own. There is discharge, and the commonly done procedure, of course, is DCR. DCR, you can get it done by an external route, that is here. You'll have certain stitches here, and the line which is left, it sort of fades away within about 6 months. Or you can undergo it through the nose route as well. So it depends on what your surgeon prefers, the route through external route or the endoscopic endonasal route. So these are common ways to address this condition. What are the potential risks and complications? So, the risks, I would say, is the risk associated with any surgical procedure, that is infection. You can have a lot of bleeding if your BP is not controlled, or if you're on any blood thinners. You will be asked to sort of stop the blood thinners 3 to 4 days prior to the procedure, along with your physician's clearance, of course. And your blood pressure has to be controlled well. So on the day of the surgery also, we will be checking for your blood pressure to make sure that you don't develop any severe bleeding after the procedure because of dislodging of the clot or whatever. So these are taken care of by the anesthetist, because you will be operated under some amount of sedation, not completely unconscious, but you will be operated with some amount of sedation. So the BP can be tackled at that time. But after the surgery also, you have to be regular with your BP medication so that you don't develop any bleeding. And of course, we do give you a complete antibiotic cover after the surgery to make sure that you don't have any infections. The late complication would, of course, be the failure of the surgery, which can happen in 5 to 10% of cases due to various issues. So that would have to be tackled as and when the situation arises. How can I find a specialist experienced in diagnosing and treating tearing disorders? So, as I mentioned, oculoplastic surgeons are commonly trained in lacrimal surgeries as well. So, they are well equipped to diagnose and treat conditions related to tearing, and of course rule out other conditions, because they are ophthalmologists to begin with. So, I would suggest to visit an oculoplastic surgeon so that they could help you with the tearing disorder. What should I expect during a evaluation for tearing, and how can I prepare for it? So the only thing I would probably say that you should be prepared for is to undergo a syringing. That is where we put the tube in the eyelid, and flush water to see if it comes to your nose. So some people find it mildly uncomfortable and very mild discomfort that you might face during that procedure. But we do put a numbing drop and then do the syringing. So that shouldn't be too bad, but I think that's the only thing that would be different from what you could normally expect uh, in an examination for the eye. So I think that's all for the questions, and thank you for your patient listening. And for any further queries, or if you do want to get your eyes checked out for tearing or any other issues, feel free to visit us at Vision Eye Centers at City Fort Road and West Patel Nagar in New Delhi. Thank you.